I'm Dr. Barrett. I'm a board-certified plastic surgeon here in Beverly Hills, and I'm here to talk to you about the Brazilian butt lift and a common myths that are associated with it. First one is surgery can't change the genetics that you were born with. Well, it can't change your genetics as of yet, but we can change body proportions, and we do that through our surgery. Liposuction, fat transfer, Brazilian butt lift. The results aren't worth the risk in recovery time. Well, that's a personal decision. There is recovery time with every type of procedure that you do, and the results, yes, there are some risks associated with any positive that you're going to gain, but make sure you go over with your surgeon what those risks are. With the Brazilian butt lift, there are things like infection and fat embolism that can happen. Petite or thin women can't consider a BBL. I get a lot of women in my office and some men that are so skinny body fat wise that they don't have a whole lot of fat to get a BBL. That doesn't necessarily mean that they can't. Sometimes we take what fat they do have and we boost it with Sculptra, which is a stimulatory filler that helps fill in areas that we don't have enough fat for. If you gain weight after the surgery, it will ruin your results. No, actually, typically it makes your results even better. But we recommend you stay within a normal weight and normal proportions. We design the operation matching your body at the current weight that you're at when you come in for surgery. A butt lift is just about making your buttocks larger. No, not necessarily. Yes, some people do want more volume. Other people want to lift on the top. Some people want to fill in the hip dip. So it's very customized based on what you're trying to do to improve the overall aesthetic for your buttocks. Butt augmentation with implants is better. Not necessarily. Okay, when you take an implant like this is a breast implant, but a buttock implant looks very similar to this. It is very firm, okay? And so your buttock area, as opposed to your breast, is a very functional area. So you have to sit on it. Many people that get buttock implants, yes, it looks good. You got a lot of projection compared to what you would normally get with fat, but there are some functional consequences. So many of the people that actually get the buttock implants had them removed. Complication rate is also really high. So make sure you think twice about getting buttock implants versus a BBL. The Brazilian butt lift has to be done under general anesthesia. It doesn't have to be done under general anesthesia, but I highly recommend you do it under anesthesia. So this is not quite a myth, but you know, there are some people that can do it safely under local. The problem is the amount of liposuction that you need to do. If you're going to truly anesthetize the area, it's going to take a lot of numbing medicine, and that numbing medicine can be cardiotoxic. So generally, it's better to have an anesthesiologist and a board-certified plastic surgeon to be doing this procedure in an accredited surgery center. Those are three things you want to look for. If it's in somebody's garage, not a good idea, okay? That should be a red flag to you. Don't jeopardize your body and your health because people die that way. Gaining weight before surgery will produce better results. Sometimes, but if you gain the weight, you get your BBL, yes, it's gonna look good, but then if you lose the weight to get back to your goal weight afterwards, you're gonna lose your results. So my recommendation for people is to be at the weight that you normally wanna be, when you're normally gonna be, and then get your surgery. That way we can design it based on the fat stores that you have and the overall aesthetic that you're trying to achieve. BBL costs less than a breast augmentation. That totally depends on your area where you go. Cost of implants is certainly a factor to consider, but the amount of liposuction you need to do to get the BBL depends on the amount of fat that you need for the BBL depends on the number of areas you need to do it for liposuction. So if it's just like an abdomen area, just the flanks, it might be less than a breast augmentation, but if you have to do abdomen, flanks, inner thighs, arms, just to get enough fat for your Brazilian butt lift, it might be more expensive because that takes more time during surgery, and that generally is what increases cost. Brazilian butt lift is a two-step process. Yes, it is a two-step process during the same operation. Basically, we're doing liposuction in a safe manner. I like to do a safe liposuction technique, breaking up the fat gently. We stay away from any energy-based devices to carefully remove that fat and then quickly get it into the buttocks so that it gets into its new home. It's like harvesting your crops, harvesting seeds, and then taking each one of those little seeds and planting in its own little space. You don't want to rush it. You don't want to put a bunch of seeds in the same spot because it's less likely to grow. You're more likely to have fat necrosis and complications. So you really want to take your time and transfer each one of those little fat droplets all throughout the buttocks in your target area. You can't sit or lay down on your butt for a month. That's not true. We have a special pillow that we provide all our patients so you can sit on your hamstrings. And I only limit it to about 2 weeks, directly sitting on your butt for more than an hour or so, okay? So sitting on your butt is okay for just brief amount of times. Otherwise, if you have to sit for extended periods of time, get a little BBL pillow like this. You can put it on your hamstring, and then you can also figure out ways to use this during sleep. And you can lay on your stomach as well, instead of laying on your butt during a BBL recovery. So that's it for our BBL myths, you guys. Thanks for watching. If you have any more questions about this, check out my website, bootybybarrett.com. Feel free to leave your comments, questions, feedback right here on my YouTube page. Give me a thumbs up if you like what you saw today, and don't forget to subscribe if you want to see more videos just like this. Thanks.